Hello and welcome to week 11 of NUR 1000. This recording will go over pharmacology. We'll also have a brief review of math tips and we'll look at matrix style NCLEX questions. So please be sure that you have read your textbook chapter over pharmacology. There's a lot of great information in there, and this recording is only going to touch on a couple of things, so not everything, even though a lot of what's in there is useful from the textbook. So make sure you've done your reading. In addition to this recording, you'll also have a recording over two medications, one for ibuprofen and one for Tylenol or acetaminophen. And those recordings will help you with a discussion board activity. So you'll need to pull out what you consider to be your 5 most important nursing considerations for ibuprofen and your 5 most important nursing considerations for Tylenol for the discussion board activity. And the reason we're doing that activity is because with pharmacology, there's just so much information. If you were to look in a med book or the textbook for a medication or multiple medications even, there's so many side effects, adverse effects, contraindications. It can be very overwhelming, and it's not realistic to think that you're going to be able to commit all that information to memory. So what we want to do is commit to memory information about medication classifications and how the drug works, and then become familiar with the prototype med from that classification. So really become comfortable with one type of medication from the classification, and then when you encounter other meds from the classification, you can use your knowledge about that one prototype med that you're comfortable with to help you have a clue what that other medication is going to do for the patient. So we'll focus on mastering classifications of meds, identifying a prototype, which is usually given to you by your instructor. So they'll say, we're talking about ACE inhibitors today. We're going to have lisinopril be our prototype med. It's important to remember that pharmacology makes up 13 to 19% of the NCLEX. So we're not just doing this for fun. It is going to be tested on the NCLEX. So for every 100 questions on the NCLEX, 13 to 19 are going to be related to pharmacology or parenteral therapies. You've probably already heard, but in case you haven't, generic names will be used on the NCLEX. So instead of seeing the word Tylenol, you'll see acetaminophen. So we'll be getting used to generic names and using generic names in class and on tests. You do have a drug recognition guide on Canvas that'll be helpful for you. I'll go ahead and pull that up. So the drug recognition guide lists different classifications of medications that have common either suffixes or prefixes. So the ending or beginning of the word gives you a clue as to which classification of medications the medication belongs to. For example, ACE inhibitors, I like to use the prototype ACE inhibitor lisinopril, but I also teach that PRIL is your clue that a medication is an ACE inhibitor. So again, you get comfortable with the classification of ACE inhibitors. You learn a prototype med, lisinopril. You recognize that PRIL as being an ACE inhibitor. So when you're in the clinical setting, if you get any of these other medications that you really didn't focus on, but you recognize that PRIL, you quickly default to, I get it, this is an ACE inhibitor. I know how this med works, which gives you a lot of information regarding the medication for safe administration. So that list is on Canvas. A lot of different classifications. I would recommend that you print this out and put it in your foundations binder and then keep using it and passing it along each semester. So put it in your Adult Health 1 binder next semester. And I would look at it every once in a while, see what meds, maybe you're learning new meds, see if they're listed on this drug recognition guide to help you easily identify meds from different classifications based on either prefixes or suffixes. So super helpful in terms of memorizing parts of drug names that can give you clues to the classifications. All right, test taking tips for pharmacology. Read the question carefully. Note any strategic words. That's old hat to you. You got that. Note the data in the question and the subject and use the process of elimination. A reminder, you may have questions on the NCLEX for a medication you haven't heard of. So don't get stressed out if you're taking the NCLEX. You're like, oh my goodness, I've never even heard of this medication. Just use the context clues within the question and your nursing knowledge to answer the question. So for instance, I teach about cancer and chemotherapy medications, but I don't make students memorize specific types of chemotherapy drugs and what type of chemotherapy drug is used for which type of cancer, but we learn about chemotherapy in general. On my exam, I might have a question that talks about a patient with a specific type of cancer getting a specific chemotherapy medication, but the way to answer it, the students can use their general knowledge about chemotherapy to answer it correctly. So just because you're not really familiar with a specific med, don't get super nervous. Try and use your context clues and your nursing knowledge to answer that question correctly. You can pause the video and look over these pharmacology guidelines. Likely you have gone over these already in class. If not, good information there for you to be familiar with. But I know you've talked about med administration, and I'm going to go back to that one, med administration in class, so I'm not going to go over all that again. So a reminder, generic names are used on the NCLEX for medications. I've already said it, but medications belonging to the same classification have similar medication actions and usually have commonalities in their side effects and nursing interventions related to administration. That's why it's important you have a good grasp of the classification of the med, how it works, and have a good grasp of one prototype medication. You can't memorize all the side effects. Focus on common side effects, lethal adverse effects, and side effects stressed in lecture and practice questions. A lot of the medication handbooks will like put the lethal adverse effects in red and the common side effects italicized or something like that to help draw your attention to them. Learn the common prefixes and suffixes for medication classifications that are found on that drug recognition guide. Just a reminder for math, we want to always be using dimensional analysis. Some of the more basic math that some students are able to do in their head even. Like they don't need to set it up using dimensional analysis. It's too easy. I encourage you to always be setting up your math problems using dimensional analysis so you get comfortable with how to set up the problems, because as you continue through the program, the math will get more difficult, and if you're not comfortable with setting up the problems using dimensional analysis, that can get hard. Be careful with decimal points. Remember, no trailing zeros. Be careful with labeling, making sure you're solving correctly. And then lastly, it's super important to make sure you're reviewing those answers and making sure they make sense. All right, your textbook has an example of a matrix style question, but we'll pull one up also to look at. So here's an example of a matrix style question. You have your question, it's giving you a scenario. In this case, you have a post-op patient, and it's asking you which of the following indicates an increase, decrease, or has no effect on a client's risk for infection. So like the patient having anxiety has no effect on the risk for infection. Advanced age increases the risk of infection due to decreased immunity with aging. So this is one example of a matrix style question. Other things you can see, or I commonly see being used, are you get a scenario, and then they give you options for what are appropriate interventions for the patient. So, and is that intervention going to be sort of an emergency intervention, a non-emergency intervention, like we need to do it, but it can wait, or is it not necessary or even contraindicated?